Yep.
Okay.
Hi everybody. Thank you for joining our latest webinar in celebration of LGBT History Month. Today I'm really pleased to welcome Sophie Meager from the LGBT Foundation. He's going to be talking to us about the impact of COVID on LGBT communities. In the usual way, please post any questions in chat. We'll pick them up towards the end. And towards the end, we'll also post an evaluation link to a SurveyMonkey piece. If you could tell us what you think about the workshop, that would be really helpful planning future ones. Thank you so much. Sophie, over to you.
Thank you. Yeah, so as Anthony said, today I'm going to be talking about a bit of research that we did looking at the impact of the COVID pandemic, specifically on LGBT communities. And to give a bit of background, really the reason why we did this research is it became clear right at the start of the pandemic that really LGBT people were being overlooked and no one was really talking about the specific impact of the pandemic on these communities. And we also saw that existing health inequalities were being exacerbated, and we knew that LGBT people face a range of health inequalities. So we knew that the pandemic would have perhaps a disproportionate impact on LGBT communities, and it was going to be really, really important to gather this information so we could use it going forward and use it to really demonstrate the need. So we ran a survey which we started at the beginning of April in 2020, and then this ran on to May, where we paused it to analyse it and to write up this report. And we had a total of 555 valid responses, and I'm going to be going over some of the results from that survey. So could I have the next slide, please? So before I go into the results of the survey, I thought it would just be important first to mention that due to existing LGBT health inequalities, there is some sort of reason to suspect that LGBT communities might be at more risk of getting seriously ill or even dying from COVID. So these existing inequalities include higher smoking rates, lower levels of physical activity, a higher prevalence of long-term conditions, poorer self-rated health, and higher rates of homelessness. However, this is very much just an estimate, and due to a lack of research and monitoring, there really is no evidence to show that LGBT people have been more likely to catch it or that mortality rates are higher. So this is very much just an estimate, but hopefully in the future, maybe some research will be done and we might be able to say for certain whether or not LGBT people have been more affected by the virus. So I can have the next slide, please. So one of the key things that came out in the survey was around mental health. We know that before the pandemic, LGBT people were more likely to experience poor mental health, with poor mental health particularly being higher in trans and non-binary communities. So we found that 42% of survey respondents wanted to access support with their mental health, and this rises quite significantly to 66% of BAME LGBT people and 57% of trans people. So there was a quote here from the survey that kind of sums this up, which said, "Like many LGBT people, I've experienced a sustained period of chronic depression before, in which I almost left my house and was cut off socially. I know how this situation is different for me, but it's similar enough to be upsetting." So this really shows how past experiences with poor mental health can come back up to the surface in the COVID pandemic, and that this may be particularly affecting LGBT people who were more likely to have poor mental health before the pandemic. And this has also been highlighted in another study called the Quarantine Study, which was carried out by UCL and the Uni of Sussex. And this again was a survey for LGBT people during COVID. And they found that 69% of respondents had depressive symptoms, and that depressive symptoms were particularly high in trans and non-binary communities. And isolation was another issue that came up. So 25% said they'd like some support to reduce that isolation, such as a befriending service. And we know that this is particularly going to impact older LGBT people, as even before the crisis, they were more likely to be isolated. So one study that was carried out before the pandemic found that 52% of gay men aged 50 plus live alone, compared to 19% of heterosexual men aged 50 plus. And obviously, if you're living alone at the moment, you're at heightened risk of being isolated, as you can't go out and see people from outside your household. So another quote from the survey highlights this isolation. So they've said, as a trans person of colour who's in older life and is already quite isolated, this time does increase the amount of isolation I experience. And I think another issue that we've seen as well is that some LGBT people, particular older LGBT people, have chosen families. So this is families that are made up of friends rather than their family, as they may have fallen out with their family or even been rejected by their family. And this might be particularly of concern for older LGBT people, as they might be being more likely to rely on people that are their own age, which during COVID is tricky because all their friends might also be shielding, might also not be able to leave the house, and may be unable to support them. Have the next slide, please. So this is a case study which is really talking about poor mental health and isolation. So this is someone that rang our helpline and said that they'd been finding lockdown very difficult. They had anxiety and depression and hadn't left the house for weeks. They were living with an older relative and were scared to go out in case they passed the virus on to them. He was LGBT and he didn't have any other friends who were LGBT, but really felt like he would want someone that would help him. And he really wanted some support around decreasing isolation, and felt that that would really help to improve his mental health. So this again brings up another issue in LGBT communities, that COVID has meant that LGBT people are cut off from their other LGBT friends, their LGBT support networks. And for many, this is really having a detrimental impact. So next slide, please. So some of these quotes really show how hard it is for some LGBT people who are unable to meet up with their friends and their support networks. So one person in the survey said, I can no longer speak with my friends in a safe environment about any mental health issues I have. Being transgender in a household that doesn't accept me is difficult. But before isolation, I could escape to a friend's house for support. This is no longer an option. Another person said, I feel very cut off from community spaces right now for obvious reasons. The lack of outlet for my sexuality is difficult, especially because I'm in lockdown alone. And I feel like there isn't a lot of talk about the emotional impact of that. And someone else said, I really miss seeing other queer women regularly, as it helped with my confidence within my identity. And I feel I'm definitely losing that with being alone. And although there have been a lot of online support groups, telephone befriending, specifically for LGBT people, that have come up since the start of the pandemic, which is great, this isn't always an option for some people. There's the issue of digital exclusion, which is affecting a lot of people who won't be able to access Zoom support groups or online information. And it's also an issue for people living in maybe households that they aren't out to or that aren't supportive of their identity. Maybe they feel that they can't have a conversation with other LGBT people in their house without being overheard. So that might be a barrier for them in seeking support. If we have the next slide, please. So another thing that came up was around alcohol and substance misuse. And we know, again, that this was a health inequality that affected LGBT people before the pandemic. We know that LGBT people are more likely to use illicit drugs and more likely to drink more regularly. And we found that 18% of respondents were concerned that the situation was going to lead to substance or alcohol misuse or trigger a relapse. And this was higher in some minority groups within LGBT populations. So it rose to 20% of BAME people, 23% of disabled people, 22% of trans people, and 24% of non-binary people. And we've seen in our substance misuse service that we run at LGBT Foundation, every time a lockdown has come into place, we've seen an increase in the number of referrals in people trying to access support. And we knew that even before the pandemic, two of the biggest triggers for a relapse were loneliness and boredom, which is obviously something that most people are going to be experiencing at the moment. So it's something that's very concerning for people who've dealt with alcohol and substance misuse. So two of these quotes sum up these issues. So one person said, I'm 2 years into recovery again, and this has added a lot of stress to my home situation. My usual stress management strategies are not available due to lockdown, and so I'm becoming less stable. It's frightening. And someone else said, sheer boredom will make me slip back into alcohol abuse. So this is in line with what we see from people who access our services, who talk about the impact boredom can have on alcohol and substance misuse. And there are also some concerns in the future. So a lot of people at the moment are talking about when lockdown ends and when we've got over the COVID pandemic, that everyone's looking forward to going out to parties, to bars, to pubs, which is great for a lot of people. But those experiencing alcohol and substance misuse might find this time particularly difficult and might find it harder to resist. Next slide, please. So we didn't actually specifically ask about eating disorders in the survey that we run, but we did get a fair number of responses around it. So thought it's something that is important to include, especially as we know that disordered eating and problems around body image do particularly affect LGBT communities, and really that there's a lack of recognition of this. Most people, or a lot of people, see eating disorders as something that just affects young women and girls, and not necessarily something that affects men or older people. So there can be some barriers for LGBT people in accessing support, as they might not feel that services are for them. So one respondent said, "My depression and anxiety is spiking more often, and I'm also still trying to recover from trauma and an eating disorder on my own, so I worry I may slip back into old damaging habits." And someone else said, "Been fighting intrusive thoughts, especially eating disorder thoughts, more. Increased focus on gaining weight in isolation and removal of usual support groups means I'm considering more kinds of self-harm." And someone else said, "I'm relapsing into my eating disorder recovery. I've just finished a 20-week CBT course and now I'm about to leave the program. Worst timing." So this really shows how disruptions in people's routines and disruptions in the support that people can access is going to be having a huge impact on people, particularly on people that were vulnerable before the pandemic started. So if we have the next slide, please. So safety was another issue that came up a lot, particularly around domestic abuse. And we know that domestic abuse has been rising throughout the pandemic, and there have been issues with people being able to access support, as some people don't feel that they're able to leave their home, which is incredibly concerning. And this is something we're also seeing in LGBT communities. So 8% said they didn't feel safe where they were currently staying. And this rises quite significantly to 15% of disabled people, 17% of trans people, and 17% of non-binary people. So one respondent said, "My partner has mental health and alcohol abuse issues. She can be abusive towards me. My only recourse is the police, which creates more problems than it solves." And someone else said, "Partner is abusive. He's already abusing alcohol. He doesn't cope well being cooped up in a small area and being disconnected from people." And again, this is something that we've really seen reflected in our domestic abuse programme at LGBT Foundation. So these figures were from May when we released the report. We found that since lockdown measures were introduced, there'd been a 38% in the number of people referred for domestic abuse support. There was also a 38% increase to calls about domestic abuse to our helpline, an 820% increase in domestic abuse webpage views, and a 340% increase in unique views to the domestic abuse webpage, which is incredibly concerning. And it's also concerning when you look at some of the barriers that LGBT people who experience domestic abuse face. So, for example, there's a lack of refuge spaces for men. Trans women often find that they're not allowed into female-only domestic abuse spaces. And there's a real lack of recognition of domestic abuse in same-gender relationships, and perhaps a stereotype that women can't be perpetrators of domestic abuse. So for a woman in a same-gender relationship, they may not feel that their experience is being recognised and that they can seek support. Could we have the next slide, please? So again, another issue that came up is people that have to live in LGBT-phobic households, so maybe households they don't feel that they can come out to, or households that they are out to and who are not supportive of that. So one person put, "My grandparents don't know I'm gay. I believe they would throw me out, be unhappy, hurt and upset, so it's not a happy place to come out." Another person wrote, "I'm transgender but not out. My parents are transphobic. Having to pretend to be someone I'm not all the time is physically, mentally, emotionally and spiritually exhausting." And again, this is an issue that is more likely to affect younger LGBT people who are more likely to live with their parents. But this next quote shows that it can also be affecting older LGBT people who may have moved out and had to move back in. So one person wrote, "We decided to care for my wife's mother during the pandemic, but it's meant that I'm back in the closet. I'm trans." And we also got a case study from our helpline. So someone called Jade, who lives with her family, who look after her because she had additional needs, rang up and spoke to us, and she spoke about her difficult relationship with her family members that had only been getting worse in the COVID pandemic. Her family didn't support or understand her trans identity. She wanted to be able to explore her gender through things like clothes and makeups, but was scared that her parents might harm her if they caught her doing this. And this was an issue that other charities reported, and the CEO of an LGBT youth homelessness charity called LGBT actually advised LGBT people not to come out during the first lockdown because they didn't necessarily know how their parents would react, and it would be very difficult for people to leave their homes and to get support if there were any issues during that time. Next slide, please. So another issue around safety that came up is hate crime. So one person wrote, "As a trans woman, I'm getting abuse when I go shopping. And shopping times mean I can't go early to miss everyone." Someone else wrote, "I've been subject to a much greater increase of online bullying and transphobia during lockdown, and I worry that people may trace my address." Someone else said, "I don't usually spend that much time in my local area, which isn't known for being very queer friendly. So walking around as a queer person has been a bit nerve-wracking." We also had some people report that they'd been experiencing abuse from their neighbours, which they felt before they could get away from, but during COVID they couldn't escape from. We also saw at the beginning of the pandemic a real increase in calls about discrimination to our helpline. So there was a 450% increase in calls about biphobia, a 100% increase in calls about transphobia, and a 52% increase in calls about homophobia. And again, I mentioned the Queerantine study that has also been running, which was a survey of LGBT people, and they also found a similar thing. So they found that 16.7% had experienced some form of discrimination based on their LGBT identity since the start of the pandemic. And they found that these people who had experienced harassment based on their LGBT identity were 3 times more likely to experience significant depressive symptoms, which really shows the impact that these kind of experiences can have on people and their mental health. We have the next slide, please. So access to healthcare was another issue that came up, and is an issue that's been affecting everyone, including people in LGBT communities. And again, it's worth mentioning that even before the pandemic, a number of LGBT people faced barriers to accessing healthcare, were more likely to be reluctant to access healthcare, and when they did, were more likely to report that the healthcare that they accessed didn't meet their needs. So this may be an issue during the pandemic that's particularly affecting LGBT people. So 16% said they'd been unable to access healthcare for non-COVID related reasons. And this rose fairly significantly to 22% of BAME people and 26% of disabled people. 34% had a medical appointment cancelled, which again rose to 39% of BAME people, 42% of disabled people, and 42% of people aged 50 plus. 23% said they were unable to access medication or worried that they might not be able to access medication, rising quite a lot to 37% of BAME people, 36% of disabled people. And interesting, antidepressants was something that came up quite a lot. So 27% of people that said they were that there was medication that they couldn't access or worried they weren't be able to access mentioned antidepressants or some kind of other medication to manage poor mental health, which again links with the findings that more people want support around their mental health. So one respondent wrote, "On antidepressants and my dosage has not been available for over a month. I've had to take smaller dosage and take double the amount. Concerns me that they might run out of that dosage too, and then where will that leave me?" So when you have concerns around accessing antidepressants and medication to manage poor mental health, paired with the fact we are seeing poor mental health rising It really is very concerning. So we have the next slide, please. So access to healthcare was something that access to healthcare for trans and non-binary communities was something that again came up a lot, and we found that trans and non-binary people were more likely to have been affected by disruptions to healthcare compared to the respondents to the survey as a whole. So 45% said that they were unable to access or worried they might not be able to access medication, and this compares to 23% of all LGBT respondents, so that's quite a lot higher. And a lot of trans people mentioned access to hormones and other medications that would help with their transition. So one person wrote, supply of HRT patches is slow and poor at the moment, worse than it has been, and it's been poor for a month. Still waiting for my latest prescription. So HRT is something that some trans women take as part of their medical transition. Another person wrote, while I am able to access some other medication and healthcare via my GP, I'm unable to access transition-related healthcare due to GICs closing and being unable to access trans-related healthcare with my GP due to lacking gender services. So a GIC is a gender identity clinic, which is a specialist service that some trans people will access in order to medically transition. Another person wrote, being post-op transsexual, I need my hormones and I'm worried that I won't be able to get them both through the COVID-19 virus, and for me, that wouldn't be worth living. So something else also that came up was trans people really feeling like throughout kind of history, their healthcare has really been treated as non-essential, and they've faced a number of issues in the past getting access to healthcare. So there was a big fear when the pandemic started that they would be one of the first people to lose their healthcare or to have their healthcare reduced, as it has been viewed as being non-essential in the past. We have the next slide, please. So again, so the last slide was more talking about access to medication, but access to healthcare in general was worse. Trans and non-binary people found that they were worse affected. So 27% of trans and non-binary people said they'd been unable to access healthcare due to non-COVID related issues, compared to 16% of all LGBT respondents. So one person wrote, the waiting times for GICs are only getting longer. Knowing this has made my dysphoria so much more unbearable. Life feels utterly hopeless. So dysphoria is the discomfort or distress that trans people might feel when their gender identity doesn't match the gender that they were assigned at birth. And the next quote is quite a long one, but I think it's really important to go through as it really sums up the issues that a lot of trans people do face. All remaining trans surgery has been cancelled because it was left unfinished, and my GIC want me to get re-referred and even start the whole thing again. I was meant to be sent to a surgeon, but now they have told me I have to go to the GIC. They refuse to see me, then years of waiting and appeals, not hearing anything, complaints not dealt with. Each attempt to contact the GIC got worse and made the situation worse. 15 years of further delays from the GIC and Health Board, no apology. Now all trans treatment and appointments cancelled. They won't even do the basic admin stuff, following up my unprocessed and lost referrals. And so again, this really shows how issues that were happening before the pandemic have been further worsened during COVID, leaving some people in very bad situations. Next slide, please. So some people also had concerns around sexual health. So one person said, I was trying to get access to a sexual health clinic and couldn't find any services. One person said, I'm not sure yet how I'll be able to access my 3 monthly PrEP supplies due next month. So PrEP is a drug that has to be taken daily that prevents people from getting HIV. Someone else said, I've already been unable to access both PrEP and PEP due to sexual health clinics being closed to face-to-face appointments. So PEP is a drug that that someone takes if they think that they might have been exposed to HIV, and the first dose has to be taken within 72 hours. So it's very concerning that people aren't able to immediately access that. And this is summed up again in the next quote with someone saying, I've had accidental unprotected sex and need PEP urgently. I was unable to access it as all the local clinics were closed. And another person wrote how PEP was taking longer to arrive by post. And there's also, again, similar with the concerns around alcohol and substance misuse, concerns about when we come out of lockdown, we might see a rising demand for sexual health services, and services may not be able to keep up with this demand. Next slide, please. So 64% said that they would rather receive support during this time from an LGBT organisation. And this rises among some groups within LGBT communities, so 71% of BAME people, 69% of disabled people, 76% of trans people, and 74% of non-binary respondents. So one person wrote, "This is a vulnerable time and LGBT-specific organisations make me feel safer." Someone else said, "Mainstream providers are usually ill-equipped and lack knowledge to be able to provide the best care for LGBT communities. If I'm accessing services at an LGBT charity, I'd feel safer because I know they will get the challenges I'm facing without having to educate mainstream professionals." So again, I think this really shows we know that mainstream organisations have come on a huge way when it comes to their support of LGBT communities, but these figures really show that there is still a fair bit of work to be done. And another thing that came up in the survey when talking about support was some people had concerns about accessing COVID mutual aid groups. So we know that COVID mutual aid groups sort of sprung up at the beginning of the pandemic and were often just comprised of neighbours and local people and weren't necessarily sort of professional organisations. And some LGBT people felt a bit wary getting in touch with these groups to access support because they didn't know what kind of discrimination they might face, and they knew that if they experienced something, that person might not necessarily be held accountable because they weren't being formally employed by that COVID mutual aid group. So again, that's something else to consider, and that's an issue that might particularly be affecting older LGBT people and LGBT people with health conditions that mean that they have to shield. The next slide, please. So in terms of next steps of the report, when we found these findings, we knew how important it was to share them wider, to try and raise awareness and get people to understand that we are seeing a range of issues within LGBT communities as a result of COVID. So we shared this with a number of public sector bodies such as Government Equalities Office, Greater Manchester Combined Authority, Public Health England. We also shared it with the NHS LGBT team. We managed to get some kind of press coverage. So we had an article in iNews, in Manchester Evening News for ID, and there was also a piece on ITV Granada about the impact of COVID on LGBT communities that we were able to feed into from this report, which was great. There's also more research that's been done. So LGBT charities Stonewall and Intercom Trust have also released the same survey that we've ran. So we've received over 1,300 responses in total, although the figures that I just went through, that was just from our own survey. And we've just received some funding to work with NatSen, Intercom Trust, Consortium and Stonewall to bring together all this data and to do a bit more qualitative research to try and build up a bigger picture of the pandemic's ongoing impact on LGBT communities. And then we're going to be looking at how the LGBT sector can work to try and overcome some of these issues. So really what's most important, again, is about spreading awareness. So you can find the full report here, and if anyone can share it, can tweet it, whatever, that would be great. And I've still got a bit of time, so I thought I'd go over quickly some of the recommendations. So what can we do about these issues that we're seeing? So really, one of the most important things that can be done is around monitoring. So monitoring trans status, monitoring sexual orientation of people accessing our services, because as I've said, there is really limited research in the area. There's no research on how LGBT people are actually being affected by the virus and whether they're more likely to die or get ill or catch it. And we would be able to have this data if there was better monitoring, if these questions were being asked of people coming into hospital, of people getting ill. So that's so important that anyone accessing NHS services or any services, that people do ask their sexual orientation and their trans status. And these would usually be asked alongside other information such as ethnicity and age and address and things like that. It's really important to take these learnings into service provision and just be aware of how LGBT people are affected. So if an older person comes into your service, you might want to be aware that they're at higher risk of being isolated, that they might not feel comfortable accessing some support that might be recommended for other people. And again, it's just really important to have these conversations with people. There might be an LGBT person who doesn't feel affected, who feels fine, then there might be someone else who is. So it's about having those open conversations with service users. And also signposting is incredibly important. So we saw in the last slide how a number of people would prefer to access LGBT services. So it's really important if someone comes into your services, you know where these services are, you know where you can signpost people to, you know what services exist. But then there also are concerns around the funding of LGBT charities. They don't receive a lot of funding compared to some other issues, and there can be a bit kind of patchy provision. It can really depend on where you live as to whether you can get access to an LGBT specific service. So funding these services is so important. And it is just important to keep researching these issues going forward. And research bodies need to make sure that they are funding research into the impact of the pandemic on LGBT people. So that was everything I had. So as we've got a bit of time left, I thought I could talk quickly about a recent bit of research we did looking at LGBT people's views on the COVID vaccine, which was really interesting. And so overall, the findings were really positive, and we don't feel that LGBT people will be less likely to take the vaccine, because that's something that we've seen in other minority groups. But there were a few specific issues that came up. So some people who were HIV positive were a bit concerned about taking the vaccine and how that might interact. So it's important to be aware of that, and for people to educate themselves and be able to spread messages to say, to kind of educate people. Another issue that came up was some trans people who were taking HRT didn't know how it might react with that. And again, there's very little information around that. So it's really important that those concerns are addressed. And then the other main concerns that people had were just general concerns about safety and side effects and allergies. So it's just really important that any mainstream messages about the vaccine are also targeted at LGBT communities, specifically during this time when it's LGBT History Month. It's a great kind of tie-in and way to use that.
Good.
So that was everything.
So thank you so much. Got some questions for you. Hope you're okay to do a few Q&As with us. So lots of praise in the chat around the presentation. Really helpful, really clear. People are saying they've learned things they weren't aware of before. Really helpful perspective to look through the lens at this time on the community. Going back to your slide around biphobia. So one of our attendees has asked, why do you have a sense of why the increase in biphobia is 450%, which is considerably higher than homophobia or transphobia? Do you have a sense about why now?
Yeah, that's a good question. And I think part of that was the fact that before the pandemic, the calls around biphobia were a lot lower. So an increase would show up as being a higher percentage, if that makes sense. So I don't think that there has been a specific increase in biphobia compared to homophobia and transphobia, but I think in general why hate crime has been rising is that people are stuck in their local areas and feel that they can't access safe spaces, so may just have to be in the area where there is higher hate crime. So one person mentioned about their local area not being very LGBT friendly, so they didn't feel particularly safe there, whereas before they may not really spend much time in their local area. And I think just again, when times are more stressful and more hard, you do see hate crime rising. So I think, around the biphobia, I don't have a particular answer, and I'm not sure whether there really was an increase in biphobia or if it was just the way it was reported. So yeah, I'm not 100% sure, but I hope that helps a bit.
No, that's really helpful. So I was just reflecting on the data, and one of the things that we struggle with in the NHS is engaging with people through the staff record, to people to self-identify as LGBTQ. And it's really important that we address that gap in reporting, because we need to understand who we're working with in order to improve experience and design services accordingly. So I think one of the things, I'm just interested in your view on this, I do think one of the things that we forget sometimes is about kind of our gay history in terms of the times that people have lived through. So the AIDS epidemic, HIV, and of course Section 28. So in terms of our expecting people to disclose and feel safe to do so, does your research kind of reference that or kind of support my thinking, or do you think it's different to that?
No, you're definitely right, and we do a fair bit of work around monitoring, and we do still find that a lot of people are reluctant to disclose and are unwilling to disclose. And again, it may be particularly affecting older people who've lived through kind of times that were a lot worse and times of really bad oppression. So no, that is a definite issue, and something that we do a lot of work around is supporting organisations to really encourage people to disclose their LGBT identity. So a big part of this is making sure that services have good awareness, that are doing specific kind of outreach to LGBT communities. So in a doctor's service, they might have an LGBT notice board with posters. They might make sure that all their GPs have been trained in LGBT awareness, and this can really, really help to make people feel more comfortable to disclose. And also, I think people being aware of why this information is being collected really does help. So we did some research, and among people who didn't want to disclose, a really significant number said they would be more likely to disclose if they knew why the information is being collected, because I think there's still a lot of, why do you need to know that about me? Why is that relevant? So it's about service providers really understanding why it's so important to collect that information, so they can explain it to anyone that's asking, and those people can then know and be more likely to disclose. And it's something that's going to be big at the moment, because we've got the census coming up in March, and that's going to be asking questions on gender identity, on sexual orientation for the first time. So we've got a lot of work to do in encouraging communities to fill in those questions and saying it's not just the government being nosy, it's so important that this information is collected, and the fact that we've not had this information before has been hugely detrimental, and means that a lot of issues get missed or don't get spoken about or aren't recognised. So I think that's one of the most important things is people understanding why it's so important to disclose.
No, that's really helpful. One of the things that we've done is to really do a lot of work around our individual staff risk assessments, particularly through the pandemic, and where we're all working more remotely, of course. So understanding how we still support our staff, and that's particularly difficult when we're doing it virtually, of course. So we're expecting people to have really honest, open conversations about their personal domestic circumstances in a way which is difficult when you may not necessarily have a rapport with that person, or they may be in a space where the person is also in it with them, they can't disclose. Do you have any thoughts about how we might do that a bit better?
Oh, that's a good question. I guess the main thing is just about making people feel comfortable to have those conversations, and being really open and providing that specific outreach. There's a huge range of stuff you could do in terms of supporting, say, LGBT staff who maybe there's someone who's living at home with their same gender partner that they've never told anyone about before, but suddenly they're both working from home, and there's concerns around that. So it can just be really small steps around making LGBT people feel more comfortable. So for example, it could be putting pronouns on the end of emails, having a really clear kind of anti-discrimination policy that's not just among the rest of the policies, that's put front and center on a website that all staff are aware about. Perhaps even the fact running webinars like this, other organisations can do similar things, putting comms out saying that they kind of support LGBT History Month, and doing stuff around that. So I think it's a lot of little things. There's no kind of fix-all solution, but it's just about doing as much as you can to make people feel comfortable and feel happy to share information that's maybe more personal and that they wouldn't have shared before the pandemic.
It's talking, isn't it? It's about asking respectful questions and being honest in our responses and building some trust and rapport at every opportunity, I think. So another question from the chat. Were there any results from the survey that particularly surprised you or the foundation? Or do you think the results were predictable?
Oh, that is a good question. I think none of the topics that came up particularly surprised me. I think we kind of knew what kind of issues that we would be seeing. But I think what particularly surprised me was some of the free text comments and the number of issues that people were facing and the really, really concerning situations that a lot of people were in. So I think it was kind of the volume of concerns that surprised me, and that's why I included a lot of the quotes in the presentation, because I think they really, just the stats alone, I don't think say enough. I think it's the quotes that really say so much, and this is just one survey of 500 people that we did, and this is just people that are happy to share, and the fact that this amount of information came up was surprising for me. And even in the report that's full of quotes, I still couldn't include everything because there wasn't room. So that I did find particularly surprising. And I think also the fact that someone's happy to answer a survey shows that already they're in a bit of a privileged position. So there's probably a huge amount that we've missed from people who don't feel safe to answer an LGBT specific survey, that don't have access to the internet, etc. So I think the fact that this kind of self-selected group of people had this number of issues was the main surprise for me.
And in the work that the foundation does and your pre-existing knowledge, do you think some of it was predictable?
Yeah, I think a lot of it was predictable, because I think we knew about all these inequalities that existed. As soon as the pandemic started, we knew that inequalities were going to be exacerbated, and people that were in a more vulnerable situation before the pandemic were going to be worse affected, and we're going to find that their existing issues were exacerbated. So I think it was something that we did predict. I think especially as a large part of our organisation is service delivery, so as well as doing policy and research, we have quite a good knowledge of the issues that we see in LGBT communities, and we can see these issues kind of before they're published or before they've been officially recognised, because we've got people coming through our doors every day. So I think, again, yeah, that kind of helped us to predict these issues that we're seeing at the moment.
Do you think, given the amount of distress that we're hearing about in terms of restoration of services and re-engagement with communities, how do you think we can address that to build confidence in the community again? I know there were some generic things about building confidence in lots of groups, about reinstatement of health services and kind of restoration of steady state, but is there anything in particular we could do with our LGBT communities, do you think?
I guess it's kind of the stuff that needs to be done was the stuff that almost needed to be done before the pandemic. So it's around funding LGBT services, people being aware of LGBT services that exist and being able to refer into them, services being really, really proactive in the support that they offer, and not just saying, oh, well, we treat everyone equally, because that's not the best way to go about things. You need to be aware of inequalities that exist in certain groups and certain populations, so you can address those. So yeah, it's just the kind of list of things that can be done to improve support for LGBT communities coming out of the pandemic. Those need to be focused on, and we need to not lose focus of that and think, oh, well, all our work's tied up with recovering from the pandemic, because actually work to address inequalities is also tied up with addressing the pandemic. So they shouldn't be viewed as being separate and let's focus on the pandemic now and then we'll look at inequalities later when we've got time. They should be looked at together.
How do the results kind of compare nationally? So in the different regions, does the Northwest come off particularly badly or particularly well, or?
Yeah, so that's something I looked at. So I got all the results just for people in Greater Manchester compared to people across the country. And actually they were pretty similar. So we found that people in Greater Manchester were kind of, the percentages were fairly similar to people across the country, which I think was interesting. But I guess also I think at this point the survey, the size of the number of respondents isn't necessarily enough to be able to do a proper comparison of areas. I think you'd need to do a bit of a bigger survey to look at that. But the stuff that I did look at, there didn't seem to be a particular difference.
Last question from the chat then. Do you think if something like this was to happen again, that the organisations, government, society have learned how to ensure groups are protected and supported? What do you think so really the essence of the question is essentially, what have we learned from this situation? And if we were to take anything good away from it, what might that look like?
Mm-hmm. I guess what we've learned is really just the damaging impact that inequalities have. And I think that's one of the main learnings that we need to take away from this pandemic and going forward and look at, because I think before a lot of these inequalities were hidden and they're coming to light a lot more. I think particularly inequalities for BAME people of colour, they're getting a lot more attention, which is great that more people are recognizing that. So I think really that's the key learning that we need to take away from this, that inequality is not just a small topic that needs to be addressed sometimes when you've got the time and the money, but actually it's something that's having a huge impact on people, and that unless these inequalities start to being addressed, we're going to see a similar thing happen if we ever were to have another pandemic or another kind of big global disaster like this. So I think that's one of the key learnings we need to take away.
That's really helpful and a really good place to end, I think, today. Sophie, thank you so much. Really helpful. If people wanted to contact the foundation, and forgive me, I couldn't see because on my screen the slides are really small. Was there a contact for the foundation on any of your slides?
Yes, it should be on the next slide. My email's there.
Okay, fantastic. Thank you all very much indeed. Can I ask please that people complete the SurveyMonkey link that Evo has posted? Really helps us plan future sessions. Thank you so much for joining us. Have a great day. Thank you. Cheers.
Thank you. Bye.